So why don't we get started? Welcome, first of all, for joining. Thank you for joining us this morning. My name's Chelsea Miller. I'm the Communications Director at the New York State Coalition Against Sexual Assault. And I'm joined by a wonderful panel of folks who have been doing really promising community outreach and coordinated community efforts during the pandemic. To get some housekeeping out of the way, first I'll show our agenda. We're going to do some introductions from each of the organizations that are partnering here. And we'll introduce what we're calling the Pharmacy Initiative, which is we'll talk more about that later, but that's a statewide initiative of outreach to pharmacies and drugstores throughout the state. We'll also have some time for show and tell. So we're joined by Sharon Lyons from Ulster County Crime Victim Assistance Program, who is going to share a little bit about what her program has been working on. And we'll also give folks a chance to share what you're working on too, because we expect to hear that you've also conducted some really important outreach during the pandemic. And then we'll also have time for Q&A. For some technology housekeeping, this session is being recorded and it will be distributed to you by email. Live captioning is also available via Otter. You should be able to, let's see, Chris, are you able to get the link for the Otter transcription?
I'll look for it.
Okay. If it may be available, if not, I apologize for the technical issue there. If you have questions related to content, please enter those in the chat box or the Q&A box. If you have questions related to technology issues or have other feedback, please use the chat box for that. Chris, I don't see the Otter link, so I'm not sure if it'll be available today.
Yeah, I'm not seeing it either.
Okay, so it's not just me. So apologies for that. We were hoping to provide live captioning, but it doesn't look like that's working for this webinar. So why don't we jump into introductions? So first, we've got our folks at the New York State Coalition Against Domestic Violence. Who would like to introduce themselves now?
Well, that would be me, Chal. I'm going to start. This is Joan Gerhardt. I am the Director of Public Policy and Advocacy at the New York State Coalition Against Domestic Violence. And just a couple of words about what NYSCADV does for those of you who might be unfamiliar with our work. We are a statewide association, a not-for-profit, and we represent the 100 or so residential and non-residential domestic violence programs across the state. And we support those agencies by a combination of training, technical assistance, advocacy. We do a lot of work with the New York State Legislature and in DC with Congress, all to advocate for the rights and needs of domestic violence survivors and their families, as well as the staff and management of domestic violence agencies to ensure that they have the support they need to provide support to survivors. So we do our work with an anti-oppression lens. We do a lot of systems reform work, a lot of social change work, and really try to elevate the voices of survivors in everything that we do. Maureen, would you like to introduce yourself as well?
Just to say welcome, everybody. Thank you for joining us. I'm Maureen Castell, Director of Prevention at NYSCADV, and it's a pleasure to be here with all of you today. And thank you, Joan.
Great, thank you. Chris, would you like to introduce yourself and introduce NYSCASA?
Sure. Hi, everybody. I'm Chris Ballerano, Senior Director of Collaboration and Training at NYSCASA, New York State Coalition Against Sexual Assault, where I've worked since 1999 on the Sexual Assault Mental Health Project known as Building Connections, and then that has also developed into many other hats that I've worn over the years. So I am currently Senior Director of Collaboration and Training, as I said, and working with a team of program staff who we really coordinate many different programs, from Prison Rape Elimination Act to prevention, to campus sexual violence prevention, as well as response to sexual violence on campuses. We have a grant that looks specifically at underserved populations, our SIRSA grant for systems response and transformation. And we are basically a nonprofit coalition of the community-based rape crisis programs throughout New York State, those that have been certified by the Department of Health. And we are looking to expand our membership to include other partners as well, other programs as well. We currently continue to provide training, support, technical assistance, and advocacy to people and organizations who support survivors, all survivors of sexual violence. We are committed to ending all forms of sexual violence and oppression. We are very much looking through our lens of an anti-oppressive lens that from the beginning when I was first brought on, and even before I came on board, our mission has always been to use the phrase intersectional, anti-oppressive, and noticing and being aware that sexual violence is just one form of oppression that's linked to many other forms of oppression. And so our work is always built on collaborating with other partners in the state and in the country who are focusing on human rights and really nonviolent communities, trying to create safer communities for everybody. So it's been really delightful to continue our work with NYSCADV, who long time ago, we were both located in the same location, even just a couple of doors away from each other. And, we've grown and expanded what we offer, but we're still very much connected and very much overlap our concerns and find ways to partner on projects like this. So it's really delightful to be able to work on this one with y'all.
Thank you. And before we move on to RISE and having Flannery discuss, Sharon, would you like to introduce yourself briefly?
Sure. I'm Sharon Lyons. I supervise the Ulster County Crime Victims Program. We've been around since 1979, and we've grown quite a bit, since that time as well, particularly really in the last 5 years or so. We are the Rape Crisis Program for the county. We're a dual services program where we were also the DV provider for the county. We recently took a trafficking program under our department as well this year. We do participate with the Enough is Enough program, the PREA program as well. And we even have our own building now starting this year. We have 11 staff now. When I started there, we had 4 to 5 staff. So it's really come a long way.
Great, thank you. And we're so glad you're here. So next, I'll turn it over to Flannery, who's going to introduce herself and RISE and speak a little bit about how this collaboration came to be.
Great. Thank you so much, Chell, and hello to everybody. My name is Flannery. I'm the Director of Programs for RISE. I actually started with RISE as a volunteer back in 2016 and was hired full-time as Director of Programs back in March of this year. So really excited to be here with you all and really excited to be working in this space full-time now. A little background on RISE. We are a national nonprofit that was founded in 2014. by Amanda Wen, who is herself a survivor, and it was founded when she penned her own rights into existence. So the Sexual Assault Survivors Bill of Rights, which is our pillar program, was passed unanimously in the United States Congress through both houses in October of 2016. It was signed into law by President Obama, and it was the 21st bill in modern US history to do so unanimously. So after the bill signing, about 1 million survivors reached out to RISE and reached out to Amanda to learn how they could do what Amanda did and pass these same rights on a state level. So that's essentially what we do. We go around the country and help individuals who are on the ground in each state pass their own laws that are modeled after the federal law that was signed into law in 2016. So far we have passed 32 laws in 26 states, and that's including 3 laws this year during the pandemic, including one in Nebraska that was just passed, I believe, a week and a half ago and signed into law. So really excited about that. We have created equal protections under the law for about 84 million survivors throughout the United States. We are still continuing our work through the United States, even though the pandemic has slowed things down considerably for us. But we are also looking at work internationally through a UN resolution. And then we sort of pivoted our attention during the pandemic once the legislative process started to slow down through each state. We pivoted to what we can do to help survivors now during stay-at-home orders, when we all know that rates of sexual and domestic violence have a tendency to spike. So this was not new information for any of us working in this space. It was not new information for many policymakers as well. But during natural disasters, during states of crisis, we tend to see sexual and domestic violence rates spike throughout the world. And that's what we have been experiencing since March in the United States. So we put our heads together and came up with something called Survivor Safe Haven to help survivors now when their communities might not be as available to them as they would be otherwise. So we have been partnering with individual businesses throughout the country, mostly restaurants, a couple of grocery stores as well. And our partners have designated themselves as Survivor Safe Havens by posting a flyer with the code word RiseUp19 in their window and training their staff to know that if somebody comes into their establishment and says the code word RiseUp19, that staff member is to take them to a safe area of the establishment, use the establishment's phone to call a rape crisis hotline, and hand the phone over to that individual so they can talk to a trained professional and understand what their options are and what possible next steps there are. So we have been implementing this initiative since March as a rapid response and are looking for ways to expand and make it something that can stick around for the long term. And through that, we were connected with Governor Cuomo's office back in, I believe, April, and had a conversation with OPDV about ways in which we could potentially partner with New York as a full state. And OPDV let us know that they actually were already working on a similar initiative. However, because of bureaucratic issues in the governor's office, they couldn't actually see their initiative come to fruition, and asked if we could potentially help them, since we had already implemented Survivor Safe Haven, do what we did with Survivor Safe Haven, but for the initiative that they were already working on. And through that, we were connected with NYSCADV and NYSCASA and have been working with them since on putting together a similar initiative that we will get into shortly. But I just have to say that this has been a wonderful experience working with everybody. And I think this has been a super successful collaboration, and I think the initiative is going to be really successful as well. So turning it back over to you, Chelsea.
Thank you. So to reiterate some of what Flannery talked about, we wanted to, as a group, focus on a couple of guiding questions. How do we ensure that victims and survivors have access to high quality, comprehensive, and continuing support during the pandemic? And how do we ensure that whatever initiative we put together does not put victims and survivors at further risk for harm? So what we had identified, because of what OPTV had already been looking into with the pharmacies and drugstores, is, we saw that these institutions are among the few readily accessible and essential services that are open during the shelter-in-place restrictions. So NYSCADV, NYSCASA, RISE, we reached out to pharmacy trade unions and pharmacy associations to develop an initiative that would support domestic violence and sexual assault survivors who come into their businesses. So some of the goals of this project are to collaboratively raise awareness about domestic violence and sexual assault, just similarly to the Safe Haven approach. This is a project that promotes universal notification and universal education approaches. So the principle that everyone receives education and information rather than screening or waiting for people to self-disclose. It encourages store owners and staff to distribute information for victims and survivors about local advocacy services and resources. It's also a project that encourages staff to be upstanders by directing self-identified survivors to seek help via local victim services organizations. It's also encouraging pharmacies and drugstores to establish or enhance their relationships with local domestic violence and sexual assault programs. It's something that we think can be expanded beyond just pharmacies and into other essential businesses like restaurants, as Flannery described, to grocery stores, which many DV and SA programs have already been doing outreach with. It's also a project that we hope ensures that survivors of violence and their families receive comprehensive support in a timely, sensitive, and appropriate manner. And not just domestic violence and sexual assault support, but support with accessing food, shelter, job security, COVID testing if they want it. Before I move to resources, does anybody want to add something that I might have missed? So the biggest part of developing this project was actually developing materials for pharmacies to distribute. Actually, we're going to get to that later. First, I've got Lorian on deck to share a little bit more about coordinated community response.
Thank you so much. Yeah, so I'm just going to take us briefly through some of the best practice principles around coordinated community response. And it's really just a reminder that the rape crisis and domestic violence programs and dual programs, crime victims programs, in this meeting already really know how to do this. So, when New York first went on pause early in the pandemic, NYSCADV convened a webinar, a learning exchange on what outreach and coordinated community response looked like. and what engaging organizations, agencies, and what were considered essential services, what that looked like in sort of this new world, along with media engagement and what outreach to media and social media might look like in this world that we were suddenly living in. But it was really, as I said, a reminder to all of us that domestic violence and rape crisis programs know how to do coordinated community response really like no one else, as it's foundational to the work that you do to engage your community partners. And we sort of reminded everyone that you had this strong foundation in terms of training folks, in terms of creating interagency memoranda of understanding, particularly with healthcare professionals, which, all of you, we'll talk about universal notification on the next slide, but all of you have really been training healthcare practitioners for 2 decades on what universal notification looks like as a best practice rather than doing screening. So we called it universal notification or universal education, which really provided cover to folks, even though they might not disclose or self-identify right away, even just being able to say, I'm a safe person to talk to if you're being hurt at home, or if you're unsafe, or if you need access to services. So again, this is something that you all really know how to do. And so what we talked about on that webinar is just something that I'm going to touch on briefly here, which is, how to engage all of the folks that create and provide a safety net for survivors of sexual assault and domestic violence, and what it looked like to be able to prepare people, particularly our community partners, but also survivors, for the fact that we were still open for business, as so many people might not have known, and how to do that safely. So Chelsea, if you'd move on to the next slide. One of the things that we talked about was the difference between asking someone, I personally have been asked, are you safe at home, right in front of my partner, right? So, my joke was always, well, if I wasn't safe at home, I wouldn't be able to tell you right now. So we know that this is really essential to the way that you are training partner agencies, folks like chemical dependency and substance use disorder, clinicians who might not understand the dynamics of domestic violence, intimate partner violence, and the kind of privacy issues that survivors might have in terms of disclosing what they are experiencing at home. And so we just had a very brief discussion around all of that, and how this universal notification does provide some cover. So it was important to us with the pharmacy initiative to make sure that it wasn't just that it was something that everybody received, that there would be posters and flyers that were available to everybody, and that it wasn't just domestic violence or sexual assault related. So, and also in order to provide that privacy and that cover to survivors who might be taking these flyers home. And I'm just going to say that, folks may not disclose right away. They may, as another main principle, partners, we don't expect partners to become experts in domestic violence or sexual assault. We don't expect them to do high-level safety planning. And so that's that third bullet there, which is really just a reminder that one of the main pieces in terms of training and engaging our partners is to just make sure that they know what the services are, that you are the local experts as crime victims, domestic violence and sexual assault programs, service programs, and that warm referral and that relationship building is really the piece. So focusing on training, which is really just making sure that pharmacies, healthcare providers, and all of the other essential entities that we talked about are able to identify domestic violence when they see it, and that they know about you as the local experts. So again, just landing on that warm referral. I don't know that there's anything else that I would really talk about in these 2 slides. I think that's all we've got. But if you have any questions around training or the kinds of training approaches that are available, lots of great material. If you're not already engaging folks in this way, particularly healthcare providers and pharmacies, many of you have reached out and said, wow, it really never occurred to us to reach out to pharmacies. And others of you have said, well, yeah, that's a no-brainer. We're doing that. We're engaging pharmacies, we're engaging food banks, we're making sure that flyers go in all of the grocery bags, all of the pharmacy bags. And I'm really interested in the show and tell later, so that some of you can describe what you've been doing. And that's it for me. Thank you.
Thank you, Lorian. And yeah, it's really important, I think, to note, and that you've noted too, Lorian, is most of this initiative is what we've learned from rape crisis programs and domestic violence programs and dual programs who are already doing outreach services. So this is just a broader kind of version of that, I think. So we developed resources that we've distributed to pharmacies through their larger trade associations in New York State. And so we've asked folks who registered for this to take a look at those ahead of time, but we're going to take a moment to just look closely at them to let you know where you can find them if you wanted to adapt them for your community or for whatever community partners that you're working with. So we've shared a letter with the pharmacies that explains what we're doing and asks them to partner with their local victim services agency if they've got needs for training or additional resources. So you can navigate to this website. It's hosted on NYSCADV's website, but it's bit.ly/pharmacy resources. We will also be able to share the slides, which has the link in the chat, or we'll send that later. So the idea is that a pharmacy can go to this website and they can download posters, flyers, cards that they can then display in their windows and and pass out to customers. So you should be seeing the website now. If you're not seeing the website, let us know in the chat. So it's housed on NYSCADV's website, and a pharmacist or the pharmacy owner can just click and download the poster. And so we've designed these posters so that there's information for folks who are dealing with sexual assault or domestic violence or child abuse. There's also some cover. So we've got the line for the New York State Office of Mental Health Emotional Support Helpline. We've got information about how to get tested for COVID-19. We've got information about finding food and information about job security. We've also included information about culturally specific support, acknowledging that the statewide hotlines and some of the more general hotlines may not serve particular communities, as well as culturally specific support like Black Women's Blueprint, like Ignite, which provides support to deaf and hard of hearing survivors. Yeah, so this is one version of the flyer. I'm seeing in the chat. Thank you, Lorian. Only people who have the link can access the material on the website. It's not public. Thank you, Lorian. So if you have the link, you can get to this information. That brings me to another point that we were thinking about as we were developing this, is we were thinking about ways to make sure that we don't put people at risk for further harm, particularly if seeing someone who might be causing harm to somebody if they find out about the initiative. We are really concerned about what that might look like. And I think maybe, Lorian, you could speak a little bit more to this, but that's also part of why we use this cover of other resources, so that it's not glaringly obvious that this is coming from domestic violence and sexual assault organizations. So we've got these in full color, we've got them in grayscale. We've also translated them into Spanish. If there's an expressed need for additional languages, we have the option of translating them into other languages as well. So we've got these big posters. We've got a small card, which is just 8 by 5 by 5. So yeah, that
Cal,
I think,
can I add one item?
absolutely.
I just wanted to point out that with the recommendation of the trade groups, the pharmacy trade groups that we were working with, they informed us that many pharmacies, particularly those that have multiple chains, like the Rite Aids and the, Walmarts, they're fully able and capable to download these materials and make copies for themselves for their locations. So one of the foundational concepts of the program was that we develop different materials, knowing that each pharmacy owner or pharmacist would decide for themselves how to post or distribute the information within their own location. So we didn't give them any specific, you must put your poster by your front door or anything like that. Whatever they felt was most appropriate for their location, whether it was including information in a drugstore bag or putting it at the drive-through window or putting it at a cash register, that's really up to the individual location. Now, there certainly might be some locations that are smaller pharmacies, maybe they only have one location and they don't have the ability to print a poster or a large poster, flyer, whatever it might be. They do have the ability to communicate with us on this web page to request copies. And we have an arrangement with the trade groups that if we get requests for multiple copies that might be beyond what our agencies could provide to them, then the trade groups would take care of providing that. And thus far, we haven't received any of those requests, so it seems to be working well. I just wanted to add that.
Yeah, thank you so much for adding that. So we've distributed these materials through the trade groups and they've distributed them to pharmacies. So if you see them, that is very exciting. Yeah, so if anyone doesn't have anything to add, I'd like us to move ahead to have Sharon speak a little bit about the Ulster County initiatives. I'm sharing on the screen here documents that Sharon's shared with us. Would you be able to speak a little bit more about what folks are seeing here and what you've been up to?
Sure. I mean, it sounds like hearing everything that you've just done, it's very similar. When our community started the quarantine, things kind of just went silent for us here. I think people just thought we weren't working and we weren't available anymore. And, knowing that domestic violence really thrives in secrecy, as we said here, we were all very scared and feeling very helpless and, wondering how we were going to be able to help people. The cases we were getting were all law enforcement referrals, hospital referrals. So by the time we were getting these cases, a pretty bad incident had already occurred. Obviously our goal is to get those cases before those incidents occurred. We started realizing then that this was going to be more than 2 weeks, this quarantine. At first we thought it's probably just going to be 2 weeks, it'll be back to normal. And as we started realizing this could be going on for, a little while, we started brainstorming, well, what can we do? There felt like a lot of things we couldn't do, but what can we do to try to make a difference? There was no manual or anything to look up at that time. So, we've already been doing a lot of community mobilization efforts in our community with the Bystanders Against Sexual Assault and, you know, other intimate partner violence initiatives. So, you know, we said, well, why not try that with pharmacies at this point and, you know, try to partner. So pharmacies and food distribution centers seemed to be the only places we could go at that point. So it was just logical to go there. We looked up every pharmacy in Ulster County. We developed this letter that you have here. I'm glad you put it out here. And, you know, we sent it out to every pharmacist. And then we did some follow-up phone calls to make sure they got it and to see if they had any questions, you know, again, and just tried to frame it in a way that they really had a unique opportunity here to help individuals, you know, in a way that maybe, you know, they didn't have as much before. So we really wanted to give, you know, concrete suggestions to them, you know, what can you do? And again, about, you know, checking in with everybody and just seeing how they're doing and using open-ended questions like we have here, and, you know, avoiding that urge to try to have that, you know, hero complex that we're going to save people, and to plant seeds with people and, you know, to offer them support, let them know it's a safe place to come, and to offer them our information and, you know, various places that they could get help. You know, it's hard to say, you know, if it helped or if it didn't help. We did start getting some more cases, and we did see our flyers up, and we saw some information at pharmacies as, you know, we were just doing our own business in the community. So, you know, that was really good to see. And then we decided to continue our push a little more with, you know, libraries, because libraries were doing a lot of online activity and Facebook activity. So we kind of went this same route with libraries after that, and really started seeing our stuff posted in a lot of places, which was really great to see. You know, then we just went online with all the programming we were doing. Our virtual trauma-informed yoga, you know, classes all went online. We had 2 different support groups for survivors of sexual violence going online, and just kind of went from there. At this point, we're still partially home. We're kind of in a hybrid and partially in the office. We're rotating and keeping our office open, and a lot of our courts have reopened. We're going to hospitals again. And, you know, things are kind of really starting to pick up now. So that's, you know, what we tried, and we hope it helped. And we usually go with the mindset of anyone we can educate in the community that we're here and what we're doing, you know, is good for us. So we hope it helped. We hope we let more people know that we were here and gave them suggestions on ways to help people. So that's what we tried.
May I ask a question, Sharon, to build on what you've shared, which is just wonderful, and I really appreciate it so much. And, you know, the reason our initiative looks so much like yours is because we learned a lot from what you were doing. So we're grateful for that. And from what a lot of other programs we're doing around the state, engaging, as I've said, food banks or grocery stores and healthcare practitioners during those early days. So thank you very much. But you said something about wanting to make sure that these were safe places for survivors to go. And that was, we talked about that so much in the early days of planning this project, that how do you ensure that it really is a safe place to go when we know that the potential unintended consequences can be really huge among the uneducated, people who don't understand the dynamics of domestic violence and intimate partner violence, or may not understand the privacy and the decision-making that survivors of sexual assault need. And so I'm wondering if you did anything to engage your community partners with training. Was there anything that you did to step up the kind of training or information that you gave them access to, or resources that you gave them access to? Because just very briefly, one of our concerns was we didn't want folks to say, let's just call 911, right? Because that's, again, the unintended consequences, not everybody wants the police involved. Not every community thinks that the police are helpers. This is not what they want, resources and support, but not necessarily with the criminal justice system. So that was one of the pieces that we were trying really hard to avoid. Can you speak to that at all?
I don't think there's an easy answer to that. We can't guarantee that the pharmacy is a safe place to go. All we can do is try and educate the people in the pharmacy with the right information. So if they are giving people information, we can feel that it's the right information that they're giving people. We've always been really fearful of using any kind of a code word, and we've always steered away from that because we just worry about the danger of that with people. And that's kind of why we threw in that phrase. I believe it's in my letter on the form we used about, that it's human nature to want to rescue people in these situations, and that we really wanted people to resist that urge and rather follow the steps we were giving them instead. It's also why we followed up with phone calls to try to give a little more, advice, or if they were looking at our material, they could ask questions or we could explain things more. We did offer training with the pharmacists, and we got a lot of feedback that they would be interested in that. But I think this time has been so busy for pharmacies that it just hasn't been really practical to do that. But that's something we are going to continue to follow up on because we do those kind of trainings with bars, with restaurants, with law enforcement, with hospitals, ER staff. We do the Nurses Association for the county. We do a lot of groups that we do training with. So we would really like to bring pharmacies into this group. So we've offered it. We hope they'll take us up on it. We will follow up and offer it again, and hope that everything we're giving them is getting us one step closer to, more people being educated.
Thank you so much. And Joan just shared in the chat, the pharmacy trade groups have told us that some of their board members are interested in posting materials in local health clinics and hospital clinics. We're also hearing pharmacy trade group representatives in other states are interested in implementing similar projects.
If I could add also, we did have some pre-existing relationships with some of the pharmacists already. Having worked with them on getting HIV meds for people, who have just been to the sane unit, getting out, it's always, a bit of a process and requiring a little work in us getting them the info from OVS to get payments directly. So we kind of had a little bit of an in with the pharmacists already, or at least some of the bigger stores. So I think that did help us with at least our credibility a little bit, that they knew who we were and what we were trying to do. So I think that might have been helpful.
Fantastic. Thank you for that. So next, we'd like to hear from folks who've joined us today, because we suspect that your agency has conducted similar outreach efforts during the pandemic, and we would love to hear from you. So if you'd like to share, please share your experiences in the chat box. Selena will be monitoring the chat box and we'll be sharing. So please, we invite you to share what you've worked on. Selena, would you like to share what's going on?
Sure. Thanks, Shell. So I'm seeing a comment from, I believe, Lori. I work at Vera House, a DV SA agency in Onondaga County. I specifically work with older adults and issues of ID theft, scams, and financial exploitation. We created a scam-free magnet resource, and we partner with our local Meals on Wheels to distribute with meals being delivered to households with older adults. So thank you. Thank you for sharing that, Lori. That sounds great. There was also a question earlier. It looks like Joan and Lorianne responded to it, but I just wanted to bring that into the space as well if any other folks had comments on that. But are there any thoughts to expanding this initiative to cover elder abuse or ID theft and scams? A common scam is to request a victim go buy gift cards. Having a warning at the pharmacy could be helpful in prevention.
some of what we've seen, at least with this initiative specifically, and with what we've seen other victim service agencies doing, especially in what Lori shared here, is there's so much potential to distribute various kinds of resources through and in collaboration with various different partners. And Lorian also shared in the chat, for anyone that has had success with training pharmacists and their staff, we would be very interested in knowing your process so we can share your successes with this broadly. Does anybody else have experiences or collaborations that they could talk about?
We do also cooperate, just on the elder comment that was out there. I'm on a task force. It used to be called the Elder Abuse Task Force, but it was renamed the Older Adults Empowerment Council recently because all of the seniors that were on the group felt there was too much ageism in that title. So we recently have changed the name. We have various community members that are involved in that, as well as the MDT for financial abuse that we deal with. So we've done a lot of work with banks on recognizing scams. So kind of another community mobilization. That's kind of, we're about that. That's really been the way we've been going with a lot of things. So we've done a lot of trainings with banks and given information on how they can spot these issues and things they can do. And, you know, we have a lot of services for elders in this community. So they send out monthly newsletters and they have a lot of events and try to get all that information out to people. We haven't done a lot of the elder stuff. I'm not an elder expert. I've just been involved more with the banks on the financial abuse part, you know, but that is a good idea to keep expanding that into other areas for elder abuse.
Thank you for sharing that.
Okay, so another comment, I'm coming from Debbie. Smaller programs would appreciate the sharing of any marketing or tape messages to reach out to the community, outreach to school counselors, school staff who were very responsive and interested in referring children, and mothers and family members who benefited from connection to services or support in rape crisis, I'm guessing, programs. Thank you, Debbie.
I do want to say that there's a model, just in response to that there is a model under development here in New York State, working with the Teachers Union and the Board of Ed, that's similar to this, which is reaching out to school counselors because teachers were so concerned when kids went home and all of the learning became remote, about families that they thought that they either knew were having issues at home, that there might have been domestic violence or child abuse or neglect, or suspected, and you know what those connections might be. And so as schools were still providing, there were some school districts in New York, and I can get you their processes around this, where they were providing breakfast and lunch, and same thing, in every box or bag that went out, there was information about a variety of resources that were available in the community. So it might have been COVID testing, it might have been where the food banks were, it might have been mental health counseling, and it might have been domestic violence program shelters or rape crisis programs, among other things. You know, it might have been Salvation Army, it might have been around, you know, all sorts of whatever the community resources were. And so there's just the sort of expansion of this exponentially, the ways that an initiative like this could be used and expanded upon are really, it's infinite and really very community based. But I also wanted to say that in terms of marketing, that's the piece that we went round and round about so much. You know, can you really, we can't post this on social media. We don't want for abusers to know that there's access to resources like this. We don't want for anybody who may be restricted in terms of how they can get out in the world to become even more restricted if they know that, you know, well, going to a grocery store or a pharmacy might be a way that they could get connected to some help. So that would just be my caution about your question, Debbie, but I'm sure that there are ways around that we could be really innovative and still protect folks and their privacy and their ability to access resources when the abuser is very skilled at isolating them.
Thanks, Lorianne. There's another comment in the chat box from Naomi. There's a community listserv in Tompkins County. I posted a program called Supporting Survivors Through COVID-19. We discussed the impacts of COVID-19 on domestic violence and child abuse, available services, and how the Advocacy Center is supporting survivors during this time, strategies to support someone you're worried about, Q&A, and there was a lot of community participation and talking through scenarios. It was successful, and we provided the program several times with a ton of community engagement. Thank you, Naomi.
That sounds awesome. So we are getting close to time. So if folks want to share experiences and examples of community collaborations during COVID, please feel free to do so in the chat box. We'd also like to open it up for Q&A. So if you can add your questions into the Q&A box, that would be very helpful. If you're not able to navigate to the Q&A box, the chat box should be okay too. And Selena is monitoring those. While we wait for questions, does anyone have anything to add? I will note in the chat box, somebody asked if there's a way to get the contact information for the pharmacy trade groups. Joan shared, she's going to check in to make sure they're okay with distributing their contact information. But we worked with the Community Pharmacy Association of New York State and the Pharmacists Society of the State of New York. Yeah, any questions from folks? I have a question for Flannery, actually. So RISE has been working on getting the Survivor Safe Haven launched in other states. Are folks in other states doing something that looks more like what we're talking about?
Yeah, thank you, Chell. That's a great question. So we are seeing something similar in places like DC. And it's really, the onus has been on community programs to use what resources they have at their disposal to ensure that information and education gets disseminated throughout their communities. What we're really interested in doing is partnering with state and local officials. So we are in talks with a councilwoman in Garden Grove, California, about how she actually reached out to us back in April to discuss ways in which she could help. So they have been using what resources are at their disposal on a governmental front to get in contact with like restaurant associations and other community leaders throughout Garden Grove to kind of streamline the implementation. So I actually have a call with her to follow up right after this to see how that implementation has been going over the summer. But we're trying to create partnerships with like state attorneys general offices, governor's offices. We've had conversations with like city supervisors, just to see like who is out there, who has the best ways to getting information to the community at large. What is the, I'm so sorry, I'm blanking on the name of the organization in DC, but one of the organizations in DC has essentially taken it upon themselves to disseminate information. And they actually have put together an app to help survivors of sexual and domestic violence safely and securely contact hotline authorities, whoever they wish to get in contact with for help. So the work that they're doing is fantastic, but again, I would say it's on a smaller scale than what we've all been doing in New York State. So yeah, I would say that the goal is to get more states to do what New York is doing. So yeah, hope that answered your question.
Yeah, thank you. I haven't seen any additional questions come through, but folks, we welcome your questions and comments. If you would like to learn more or request more information from us, you can access the resources we created at bit.ly/pharmacy resources, which I'll put in the chat. And you can also email our kind of common email of pharmacy assistance at NYSCADV.org. So if your program has not yet engaged in some of these outreach efforts or would like support, any of our organizations can provide support on that. Whether it's through sharing the resources that we put together, which can be adapted for your community, or just hearing more from us. I'm sure we'd be happy to chat. We're almost at the top of the hour. So thank you all for joining. I'll keep this open if folks have questions. But is there anything that folks would like to add before we close out? Well, thank you all for joining and for being here. And it's been really lovely to work with my colleagues at NYSCADV and RISE. And thank you to Sharon for joining us today too and sharing what your program has been up to.
Yeah, it was really great to hear about that work, Sharon. And again, just echoing Chelsea's comments, it's been a pleasure to work with RISE and NYSCADV and look forward to more collaborations like these. Thanks everyone for participating with us today.
Yeah, I just want to say again, thank you everybody for all your hard work. It's truly been a pleasure to work with all of you guys. So thank you.
Good luck with the National Front.
Goodbye and thank you, everybody.
Ciao for now.
Looks like there are not any more questions coming in, so I'm going to close this up. So thank you, folks.
Thanks, Chell and Selena. I think you're the last ones on with me.
Yeah. Thank you all. Take care.
Bye-bye.